The current state of our project, like I mentioned before, so right now, first of all, we already have a viable CAR T cell that is successfully targeting TSHR that is functional both in vivo and in vitro. And so far, we have raised a major question as to antigen escape because this type of lethal thyroid cancer does downregulate the expression of TSHR. And what we have proposed here, a solution, is the utilization of the MEK and BRAF inhibitors as a strategy to block the genes that are stopping the expression of thyroid gland proteins. And we have done so far. And like we have used our MEK and BRAF inhibitors, and we have seen that number one, they're not harming the effector functions of the CAR T cells, and they're working effectively in vitro and in vivo. Right now, what we're trying to figure out in our next steps is we want to, I guess we're looking into the best strategy where we can find the best, I guess what we're looking for is to find like the best combination strategy using this MAC inhibitors along with CAR T cell therapy, either as a sequential treatment or as a combinational therapy, in order to find the optimal dose that can help us to maintain and have a higher expression of TSHR in these tumor models. But also we're still working with managing the doses of this BRAF and MEK inhibitors in order to find the optimal dose that eventually, with the hopes of us moving to a phase 1 clinical trial, we can have a good dose that it's going to be right for human patients. So that is where we are right now, just like managing still the in vivo studies in order to find the best combination pathway and looking the perfect doses or the best doses that we can then move to a phase 1 clinical trial.